Hi, everyone, and welcome back to another episode of RPEC On Air, a podcast produced by the Retired Public Employees Council of Washington. I'm your host, Alyssa Brady, RPEC Project Coordinator, and this is Part 3, the season finale of our three-part series about Medicare Open Enrollment, which I have just decided to call RPEC On Medicare. And if you've listened to the other parts of this series, you've probably heard my lovely co-hosts and I really stressing the importance of staying on top of your deadlines, doing your research, and just in general, kind of discouraging inaction. And so today we are going to cover PEBB, the Public Employees Benefits Board, Medicare Open Enrollment. And there are a lot of big changes for 2025. First, there's the change in the dates for open enrollment for PEBB. It's October 28th through November 25th. And I think from there, I will introduce our guest / co-host. First, I'm joined by Tim Smolen, SHIBA Program Manager. Hi, Tim.
Hi, Alyssa.
Good morning. And Matt Groshong is the Chapter 3 President and Healthcare Workgroup Chair, is also going to be sharing his expertise. Hi, Matt, and welcome back.
Well, hi, Alyssa. Hi, Tim.
Good morning, Matt.
And good morning. Should I take it away, Alyssa?
Take it away.
Yes. Again, Matt Groshong. I worked for 2 community colleges, and I've been a member of RPEC since 2015. And I welcome you to our second year of offering our popular healthcare podcast to RPEC members. Today's session is focused on helping those of you who get their health insurance through PEBB. And I'm very pleased to introduce our expert presenter today, Tim Smolen. Tim is the SHIBA Program Manager in the Consumer Protection Division of the Office of Insurance Commissioner in Olympia. The SHIBA programs offers highly trained volunteers who offer one-on-one impartial advice on health insurance options for retirees like us. In fact, as an aside, my first aside of many, SHIBA is always looking for volunteers. If you like to help other people weave through our very complex healthcare system, being a SHIBA volunteer might be for you. You will help many, many people. Tim says the best part of this work is knowing the impact of helping people in terms of saving them money and also in terms of putting their minds and hearts at ease. Tim has wide experience working in various Washington state agencies, including the Healthcare Authority and also private insurance companies. On top of that, he is a great friend and supporter of RPEC. Tim, thank you so much for your time and expertise.
Oh, Matt, it's just so lovely to be with you. Between the time that we recorded the first and the third programs, I got a chance to meet you and your beautiful wife, Kathleen, and meet Alyssa at the RPEC convention in Wenatchee. So now I feel like I've satisfied one of my life's goals here. I've been wanting to meet you since last year when we started working together. And Alyssa, sometimes a podcast is hard because, you don't hear things exactly the way that the person said them. But I swear when you did your introduction, I thought you said our pet project coordinator, like you were just doing me a favor here. So thank you for that.
Yeah, this is my little pet project, just a fun side thing. It is a fun thing that I'm doing, though. It's a fun project.
It's a fun project, but with a serious purpose. Matt and I started this together last year at the suggestion of Lori Widener, your executive director, who's become a good friend. And it was because there was so many changes coming in the portfolio of plans for PEBB Medicare retirees. And we were very concerned that people would not have enough time or enough resources to make a good decision. And of course, Matt and I both and Lori have tons of respect for our friends over at HCA and the other kind of coalition partners. But we continue to feel like supplementing the work, not replacing the work they do, but supplementing that work is very important. So I hope it is for your audience.
I think it will be. I know that last year they really valued what the two of you did. So, yeah, this is good. Well, let's get into some of these big changes that are occurring for PEB.
Sure. I think when Matt and I, again, when we conceived the project, we sort of thought we would start with the things that were the most impactful for the most people. And of course, that's always about the rates and the coverage. And most people, when they're working, are enrolled in Uniform Medical Plan. And that's true when they retire. And most of school retirees who come over out of that system are choosing UMP. So the good news about the rates is that they're going down relative to last year's rates. The bad news is they're still almost twice as much as the rates for the other plans in the PEB portfolio. So, as Matt and I often talk about, it comes down to just an investment decision. You're buying a product at the end of the day, and do you feel like as an investment decision you want to buy this product compared to this one? Do you have a better use for the money? And Matt and I are going to talk with you about the reality about how different are those plans in terms of the coverage that you get, because it's not exactly aligned to the premiums that you're paying.
Yes, I want to tell everybody that I used to be with UMP Classic Medicare, which is going to become UMP Classic Medicare with Part D that Tim will be explaining later. And I want you to know that it was a really stressful decision deciding to whether I should go to a different plan. But given the increases that were happening, and our budget, I went, I have to spend the time researching because I can't sustain this. We can't, my wife and I can't sustain this. So I started looking at another plan in the PEB portfolio, and I decided to take the jump. And
Mhm.
so I acknowledging to all of you that it's a stressful decision because many of you have been in the plan 10, 20, 30, 40 years, and change is hard. It certainly is for me.
Mhm.
But I can tell you that I've now been on the other plan, for more than 2 years. I'm very satisfied with the plan. I recommend everybody when they go to a new plan to keep doing research on that new plan. Don't just go, well, I've decided to do this new plan and now everything's automatic and I don't have to do anything. You're going into a new universe and you still need to keep learning. But I'm very satisfied with the plan. So just so you know, my experience, I'm not speaking for any of you, but I do urge you to look into other opportunities and see if they fit your needs.
Yeah, yeah, not just financially, but your health needs, your medical needs too. Were there other pieces that you had to kind of consider outside of just financially and what your medical needs were?
Well, yes. I mean, if you look at the charts and you compare the medical deductibles and the copay or coinsurance or the out-of-pocket limit.
Mm-hmm.
PEB has a chart. Let me see. The name of it is the 2025 PEB Medicare Benefits at a Glance sheet.
Mm-hmm.
They line up all the plans next to each other and they go down a list of the various benefits. You will see plans that are as good or better in many of the areas.
Mm-hmm.
So it's just really important to do your research. And I'll let Tim go into the details there.
Yeah, well, I appreciate that. I guess, Alyssa, I guess I want to kind of pick up the thread of what you laid down there and say, as hard as it is, I think what Matt and I would tell people is you kind of have to think about your health insurance maybe differently than you do other kinds of insurances, right? So if I was to say house insurance, Matt and Kathleen have house insurance, and they probably don't, get together with a cup of coffee in the morning, and say, do we still love having insurance with these guys for this house? Because it doesn't cost very much. The house, of course, is appreciating in value, but that really doesn't affect things like taking different prescriptions or your doctor retiring, right? So I think what Matt and I would say is that your health insurance decision, appreciating that it's effortful, you need to invest in, an annual exercise of evaluating it just because it is different than other kinds of insurances that you have. And Matt's exactly right. There are really good tools. Every plan produces what we call an evidence of coverage, and you can get that from the HCA, or you can get that directly from whichever plan you choose. And it describes in detail what's covered and what's excluded, and the conditions that apply or the qualifications that apply for covered services. So if things like referrals or prior authorizations, substitution for generic drugs, all of those details that you might care about, how many chiropractic visits, which chiropractors are in the network, all of those things are described in the plan documents, which are very accessible. Again, you can ask for them from the HCA, you can ask for them from the health plan, you can call customer service or go online and look at it or download it. And I think, I think that's just an ideal way. And I think an important distinction that, we're going to talk about a bit more later is that, the folks at the HCA, and they're, really quality people, the menu of plans that they're offering to have Medicare retirees, they're all excellent plans. They're, none of them are a dud. You can't get hurt by choosing any of those plans. They're all great plans, and they're all much better than the plans that are available in the commercial market. Now, granted, they
Yes.
cost more, right? So you're trading off, more coverage for a higher premium, but you really can't make a bad decision inside the PEBB portfolio. They're all excellent insurance programs. And because you're part of this group, every year you can reconsider. So it's not discounting what Matt said about the emotion in it, but it's a relatively low stakes decision. So that if you were in UMP and you went to United Healthcare PEB Complete and it didn't work for you, you can go back again to UMP next year, right? So you have a lot of switching rights inside the group, and you're choosing from among, really good quality plans to begin with.
Yeah, and another distinction, we are talking about changing plans within the PEB portfolio, because if you switch out of PEB, though, you can't go back into it, right?
That's correct. And that is a very important, I like to affectionately kind of joke about me and my mom in this regard, because she is a surviving spouse of my dad's insurance from the place he retired from. And every year we have this conversation that sounds like this. She says, I know that you're very busy, but I just need your help with my insurance. And I say, I'm happy to help you. I know that you said I should really stay with my group. I did say that. But I have this friend at Water Aerobics who has this plan, and she has a zero premium and it pays for her gym membership. And why shouldn't I just quit and go there? And I'm not saying you shouldn't quit. I just want you to be aware of the trade-offs. And a very significant one is, if you reconsider, they're not going to take you back, right? So this year in particular, in Washington State, there are a lot of these private plans, private Medicare Advantage plans that have historically had very low premiums and very rich benefits packages that are exiting the market. So had my mom been in one of those kinds of plans, DuPont is not going to take her back. So now she's going to have to just simply choose another different plan in the commercial market, but she will not have the same right of return. So I would highlight that as one of the reasons really to, I say, stay with your group, right? Kind of like stay with your herd. And two more that I would highlight is that making that change almost certainly affects other people who might be dependents on your coverage. Right. So groups in general will not allow a subscriber to exit and dependents to stay on the coverage. And the second thing, or the third thing, is that it might affect other the technical term we have is like post-employment benefits. So if you decide that you want your medical insurance out in the commercial market, the group might say then, well, you can't have other kinds of benefits that the group offers for things like vision, dental, hearing, right? Or other post-employment benefits. So I'm not saying people shouldn't universally never leave your group. I would say just be eyes wide open because there's pretty big consequences.
And I would also add another benefit. Not only are the PEB plans, as Tim says, benefit rich, but another benefit given to PEB members is what's called the Medicare explicit subsidy, which means that the state subsidizes our medical insurance premiums from around 115 a month to 182, which is a lot of cash. And people in the outside commercial market don't get that.
No, that's a really good point, Matt. And I think that the folks at the Retired Public Employees Council, and of course, Ask Me and other folks that are engaged with the unions, they deserve a lot of credit because they lobby for that benefit. This is a line item in the state budget, which is, effectively subsidies for the costs of insurance for Medicare retirees. And yeah, it's a substantial amount of money. So even if a plan as good as, say, UMP or as good as United Healthcare, PEB Complete, if it was available in the commercial market, you'd pay essentially twice as much. So it's a very substantial subsidy.
Yeah.
Well, let's talk about changes for UMP then for next year. As Matt said, we are going to, starting in January, which feels like right around the corner, but starting in January, and this is really what's driving the decrease in the premiums for UMP for Medicare retirees year over year, is that the prescription drug benefit now will be a private contract with an outfit called Array RX Solutions, so that the prescription benefit now will be managed by that private company, which is a contractor with CMS, the Medicare agency. So I want to make 2 points here. So the first point is this benefit is negotiated not just with the Medicare agency, but with, again, the really excellent people at the healthcare authority. So it's a formulary, it's a list of covered drugs, and it's a network of pharmacies that was negotiated by the healthcare authority with the pharmacy company, which is called Array RX Services. You're going to see the name MODA, MODA. That MODA is effectively your prescription drug provider. That benefit was negotiated specifically for PEB Medicare retirees. So again, it's a much better, Matt would say, benefit rich. It's a much better Part D plan than is generally available in the commercial market. That's the first point. The second point is it's kind of a packaged deal. So if you currently have UMP, you'll just continue in UMP and your prescription drug benefit will continue to be offered. It'll be somewhat seamless to you. You do not need to elect a Part D plan, nor do you have a choice of a Part D plan. You get your medical benefits through the Regions Provider Network. You get your pharmacy benefits through Array RX Solutions.
Tim, is this going to change the cost of prescriptions potentially? Are they looking at big changes to that as well?
Boy, that is such a great question. That's such a great question, Alyssa. So again, the folks at HCA PEB worked really hard to minimize the impact of this change, and they've done a lot of analysis about this. So for most people, they will not be any worse off because of this change. But we would, speaking for Matt, we would absolutely encourage you to reach out to the folks at MODA or Array RX Solutions and ask about the drugs you're currently taking, and say, I'm currently taking this prescription, paying this much. We could talk about retail compared to mail order, and then say, so for 2025, what is my out-of-pocket cost going to be for this particular prescription. So, in general, these conversations are kind of like at the global level, right? So our friends at HCA are going to say, globally, everyone is going to be at least as well off as they were before, but there will be some individual people who are going to experience this as being worse, and we'd rather them not be surprised. So if you're continuing in UMP, we would, especially if you take a lot of drugs or expensive drugs, HCA would say like specialty drugs. So I'm talking about things like, human-derived drugs for treatments of things like rheumatoid arthritis. We would absolutely encourage you to make that reach out now, just so you're not surprised. Now, having said that, I don't want to create a stampede. All of the Medicare plans, all the plans available to Medicare retirees are excellent drug coverage, and they all have a stop loss or an out-of-pocket limit of like a couple $1,000s. So it's not an unlimited exposure. You can't be way worse off because there are these kind of guardrails built into the plans. But you still don't want to be surprised by paying $10 or $20 more for something next year than this year.
I would just add that what PEBB says is that the overwhelming majority of current UMP Classic Medicare members will see no change in their costs for their drugs. But if you're taking biologics or some really expensive specialty drugs, that's where, it'd be important for all of you to check the cost of your drugs in the new plan. But for those of you taking specialty expensive drugs, to call MODA and to tell them, I take this, what are my costs going to be? And they'll tell you.
Yeah, thank you for that, Matt. And of course, network pharmacies, right? Let's just make sure that if you have a strong preference for a certain pharmacy, that pharmacy will continue to be part of the network. And again, just, as much as you're able, check in with your pharmacist and make sure they know that, you're going to show up next year with a different prescription card, and, the billing terminology that they use will be different. Of course, UMP is communicating this to all the pharmacies, as is MODA communicating this to their pharmacy network. But again, you just let some of the tension out of it by doing a little bit of legwork. Do we still use that expression? Do a little bit of legwork yourself. Okay, so I'll say one more thing about Uniform Medical Plan and the rates, and this is back to Matt's opening statement. If you were just to sit down and compare the plans inside the PEBB portfolio, they're much more alike than they are different. So as I did last year, I'll just do a very brief review about sort of the kinds of plans that are in the network, right? And this will help us as we engage the next part of the conversation about changes for folks who have Kaiser insurance. So the Uniform Medical Plan is what we would call a preferred provider network. So Regence has established a network of doctors and hospitals, including primary care and specialty care providers, and you have a financial incentive to use providers inside that network. You can typically see providers outside that network, but you pay more at the point of service in terms of deductibles, copays, coinsurance if you go out of network. The United Healthcare plans, there's two, United Healthcare PEBB Balance and United Healthcare PEBB Complete. Those plans look like and act an awful lot like the Uniform Medical Plan. They are also preferred provider organization, financial incentive to use providers in network, permissible to use providers outside the network, but strong financial incentives. And the covered benefits, so now we're talking about doctors, hospitals, as well as all the ancillary therapies for inpatient care and outpatient care, and things like naturopathy, chiropractic, vision services, all of those kinds of services, again, because the HCA negotiated on your behalf, in terms of the covered benefits, these plans are very much alike. The second plan then in the PEB portfolio that's an alternative to UMP, of course, is Kaiser, which has been around, used to be group health, right, for our old timers like Matt, who enrolled in group health and then stayed with them across moving into Kaiser. And people are very loyal to those Kaiser plans. They're a little bit different kind of a managed care plan because they look more like an HMO or a health maintenance organization compared to a PPO or preferred provider organization. So the expectation is that you will be assigned a primary care doctor who will manage your referrals inside the Kaiser network and outside the Kaiser network with primary care doctors. And the pharmacy benefit is typically through Kaiser owned and operated pharmacies. In general, people that have Kaiser love Kaiser, very loyal to Kaiser. They get exceptional high customer service reviews. But for people who don't have Kaiser, they're probably not really open to considering it because it just feels too different to them. The third kind of option in the portfolio for PEBB Medicare retirees is only for Medicare retirees. So it's not familiar to people when they were working or before they retired because it is a kind of a plan that we call a Medicare supplement plan. You'll also hear this referred to as a Medigap plan. So on behalf of Medicare retirees, PEB offers this plan called Premera Plan G. So Premera is the insurance company and Plan G is the kind of Medicare supplement plan. HCA picked that plan because it's the most comprehensive plan. Essentially, anything that Medicare pays for, your supplement pays the rest of the bill. So for all Medicare covered services, you effectively don't pay anything out of your own pocket. Medicare is first payer, your Plan G is second payer. The significant thing to know about these plans is they do not pay for extra benefits that are not covered by Medicare. So you will have to choose a Medicare Part D plan out in the commercial market, and you will have to make other arrangements for benefits that are not covered by Medicare. And again, I'm talking about things like chiropractors or naturopathy. So those are things that you would have to take care of outside of your Medicare supplement plan. What people like about those plans the most, number one, of course, very low premium. They can customize their prescription drug coverage to be exactly what they want based on, the dozens of plans available in the market. And it's not a managed care plan in the sense that you can see any provider in Washington State or in the United States that contracts with Medicare. So whether you like it or not, you manage all of your own referrals. There is no prior authorizations. There's no managed care aspect to the provider network. And for some people, that's very appealing.
So we talked kind of about the supplemental plans in our previous episode, which listeners may or may not have heard. But from my understanding, you have to choose the supplement plans when you actually enroll in Medicare for the first time. Is that right? Or is this kind of something different from that?
That is such a great question. Because it's a group, it's different than that. So again, would maybe go in the column of benefits of staying with your group, that if you initially elected a managed care plan like United Healthcare, by which I mean a Medicare Advantage plan, and then 2 or 3 years later, you decided that you really don't want to invest in that insurance with those extra benefits, or the network just feels too restrictive to you, you can switch to the Medicare supplement plan. Because it's still staying inside your group, you don't have those same barriers that people might in the commercial market.
Okay. So they don't have to have like a kind of like a qualifying event that would let them switch supplement plans or switch into that plan if they hadn't already done that before. 'Cause we talked about this for the commercial market. So
we did. You're a very apt pupil, Alyssa. That's exactly right. So for all the folks, and it's about 50-50, right? About 50% of people in Medicare have a Medicare Advantage plan, about 50% have original Medicare and a supplement. In the commercial market, there are rules about switching from a Medicare Advantage plan to a Medicare supplement plan And if you don't do that when you first sign up or within the first year, you would be subject to what we call medical underwriting. So the company could turn you down because you look like a bad risk. But none of that is true for people inside the PEB portfolio.
Yay.
Yeah, and let me just, because we're having all this drama today when we're recording is October 11, a couple of days ahead of the open enrollment period for people not in the group. We're estimating 60 or 80,000 people in Washington who have commercial market Medicare Advantage plans got told last week that their plans are not continuing for next year. And because it was an involuntary termination, they can move over to Medicare supplement plans without underwriting. So we're going to do our level best to reach them and help them get to a decision and use the tools. But it's a little bit sleepless night at my house worrying about that overnight.
I have a question for you. Thank you for that explanation. And I think it's really important if you could respond to the fact that the PEB portfolio has Medicare Advantage plans. There are the United Healthcare plans, PEB Complete and PEB Balance, and they're the two Kaiser plans. And they're Medicare Advantage plans, and lots of people have heard horror stories about Medicare Advantage plans. And if you could put their concerns to rest regarding the Medicare Advantage plans in the PEB portfolio, because they're way different.
Oh yeah, thanks for that, Matt. I guess I'm always I'm always trying to be neutral, which turns out to be harder than it appears to be sometimes. So just to acknowledge that I do work for state government, I do work in the Office of Insurance Commissioner, and we do regulate the Medicare supplement plans. We do not regulate the Medicare Advantage plans. That's done by the federal government. And yes, there is lots of kind of bad press periodically for Medicare Advantage plans. Sometimes it's just plainly about customer service, right? You can't get through on the phone. Sometimes it's about prior authorizations or denials or delays for people that have very serious healthcare conditions. And I guess as usual, like these things are in twos for me, right? So the first thing that I would say is that a lot of the friction that people have with their plans is because there was a legitimate misunderstanding about what the rules were or what the covered benefits were or what the protocol was, right? It's not as if the company is balking or pushing back. It's just that the person misunderstood what the contract for the benefit was.
And I don't work for the state, so I can say this,
Yeah.
or they were misled through simplistic, misleading advertising.
Thank you. Thank you. That was going to be my next observation. Yeah.
Oh,
So,
sorry.
right.
Okay.
So the headline is going to be and honestly, we experience inside PEB too. Our friends at the HCA would tell you, like, the headline is going to be like, this plan provides dental insurance. So a person could just think that means, well, if my dentist says I need it, it's going to be paid for by the insurance. Or hearing aids, right, is another classic example, right? The headline is going to be, we pay for hearing aids. But when, again, going back to when the head of our call today, when you go find the evidence of coverage, it's going to say, yes, we pay for hearing aids up to $3,000 once every 2 years. You have to use our hearing care provider and have an authorization to do so from your doctor, right? So they're not saying they're not covering it, but it's not aligned to your expectation. And that happens a lot, right? So yeah, I think that again, in general, these commercial market Medicare Advantage plans work very well for people and they're very satisfied. And there are some people that are having really a miserable experience and having a lot of regrets. And both of those things are true. And both of those things are not our retirees inside the PEB Medicare portfolio, right? Because again, HCA is your advocate and they have negotiated with the United Healthcares or the Kaisers of the world all of those details so that there's a lot less of that kind of friction that people, that you read about in the news. So again, back to Alyssa's point, a primary reason that group plans are more attractive is that the group is your advocate, going way back to negotiating that contract, but then all along the line. So, Matt, if you had picked United Healthcare PEB Complete and you were having some issues, not only can you call the company to complain, you can call Medicare to complain, but you can get a colleague in state government at the HCA, and you can complain to them, and they will take up your cause with the plan. So it is a significant advantage, and we really should think about those Medicare Advantage plans inside the PEB portfolio differently than what it looks like in the commercial market.
Huh. So, okay.
They
So in
definitely are.
Washington, it ain't regulated, but it is negotiated, right? Is
Yes.
that a good way to say? Not with the accent, I guess, but I grew up in Kentucky, so sometimes.
Oh, yeah. That's people in Kentucky have a lovely accent. My mom and dad retired to Bowling Green, and I have fond memories.
Oh, wow.
Oh,
Okay. My sister went to school there. That's great.
oh, that's fun. Yeah, my dad and
Hmm.
I used to like now we're just having fun, right? So at the Western Kentucky University, their team is called the Hilltoppers.
Hmm.
And so my dad and I would go to the Hilltoppers baseball games. It's a
That's great. Yeah.
fond
Small
memory.
world.
Yeah. Yeah.
Back to Washington.
Back to Washington. So yeah, so strictly speaking, we do not regulate those plans, but the SHIBA program, we would help you if you needed for these commercial market plans, if you needed to file an appeal or if you had a grievance, we could help you. In general, it's very simple to do, but we would navigate that. If you're inside the PEB portfolio, then you're going to reach out to Ellen Wolfhagen, and this is my shout out to Ellen. Ellen, you are a heroic person, and I love working with you, and I'm sad and happy that you're retiring at the end of the year. But good news is our friend Laura Ryan is succeeding her. And I've worked with Laura for a couple of years here at the OIC, and Laura's going to do great. So you've got Laura and Ellen and other folks at the HCA to be your advocate with those Medicare Advantage plans.
Yeah, on that note, Ellen actually, she did, I think it's like a 2-hour webinar covering the Public Employees Benefits Board portfolio and kind of going into specifics with like visuals that people can go onto our website and watch that as well as listen to this. So we cover things a little bit differently, but yeah, that's another resource that you all have.
And Ellen is great. I mean that sincerely. And that is a good presentation she did for you. She also recorded one for the UW Retirees Association that you can see at their website. And starting in a few weeks, by the time we're recording this, a few weeks out, the HCA team will be staging 19 benefits fairs around the state. So you have like an in-person opportunity to talk to the people from the HCA. Our SHIBA staff or volunteers will be there as well, as will representatives from all of the medical plans. So if you just need to have a personal conversation with United Healthcare or Kaiser, Premera, Regents, Array, or Moda, they will all be there at these benefits fairs. So if they're accessible to you where you live, besides Ellen's presentations, those are a great opportunity.
And there's also a virtual benefits fair online at the PEB HCA website.
Yeah. So with that, let me talk to our friends who are enrolled in Kaiser. And I know I got to go out to Pasco a few weeks ago and meet the folks out there. Gosh, now Matt, I'm embarrassed. Is it chapter 23 out there?
21.
Oh no.
21.
Mhm.
Thank you. Apologies to Robin, who's your chapter president out there. And Robin and I were talking about the fact that he's I hope I'm not violating his privilege or his confidence here, but he's enrolled in Kaiser and he's concerned about what happens next year because for HCA PEB Medicare retirees, Kaiser won't be available in Southeast Washington, which is very difficult, and I want to acknowledge that.
Mhm.
But again, the good news is Uniform Medical Plan, the two United Healthcare plans, or Premera, all of those would be a really good option for you. the one that's going to feel the most similar to Kaiser to you is going to be one of the United Healthcare plans, right? Because it's a managed care plan with a network, and the rate is going to be closer to what you're accustomed to paying for Kaiser. And it just kind of conforms to that model of care. But for sure, investigate UMP, for sure, investigate the Premera Plan G as options. And again, the staff at the HCA are experts at helping you do that. Please don't get frustrated with them when you want to ask specific questions about specific benefits, because they're going to redirect you to the plan. So in other words, if Robin or Susan was to show up and say, well, I think that it makes sense to me what Tim said about United Healthcare. I just want to understand, how does the benefit for chiropractic work? They're going to redirect you to United Healthcare. So it's advisable, if you have those detailed questions about covered benefits, call the plan directly. Don't call HCA. HCA wants to be in the business about things like, am I eligible? Which forms do I need to fill out? How does the premium work, or how does it change? Or if I have one Medicare retiree on my account and one not Medicare dependent, how does that work? All those questions kind of are the domain of HCA, but all the detailed benefit questions, like we said about pharmacy, if you have specific pharmacy questions about the UMP Part D plan, you're going to go to MODA. If you have specific pharmacy questions about United Healthcare, you're going to go to United Healthcare. So please don't get frustrated if you call the HCA with those questions. They're going to redirect you.
Question, Tim. I've studied this area a lot. It's not my business like it is yours, but I'm just imagining some of the people listening, they're going, oh my gosh, I'm just totally overwhelmed. I just don't feel that I can call the plans and do this stuff myself.
Mhm.
Uh, and is there anybody I can go to who can sort of walk me through the process, because I really need help?
Yeah, and that's really real. And I don't want to discount that. For a lot of people, using the computer is a barrier, right? You may not have high-speed internet access,
Yeah,
or you could be a person who has like low vision, for instance, or it just might be tedious. You might not have the skills. And then of course there's all the terminology and jargon, right? So I don't mean to
absolutely.
blithely just say hop online. That's the easiest tool, the best tool, but I appreciate that for some people that's a real barrier. So yeah, again, I really feel like one of the great things about RPEC is that you're surrounded by people that want to help you. So I would certainly encourage you to reach out to another RPEC member, reach out to another person you know from the PEBB Medicare community. HCA, I have to be really candid, during open enrollment, it can be tough to get through on the phone. But absolutely try them. And the plans really do want to help you. They have to be direct and honest, and they will take the time that you need. Again, can be challenging to get through to them. Um, the role for SHIBA volunteers here is, we're not going to be conversant with the details. I don't mean to be fixated on chiropractic, but you can't ask us, is the chiropractic benefit better with
Right.
UMP compared to UHC compared to Kaiser? But if you just got stuck, right, you were reading your evidence of coverage, and you said, I'm not sure what it means every 2 years. Is that calendar years? Does it depend when I sign up, right? Or if you didn't really understand deductible, copay, coinsurance, prior authorization, HMO, PPO, we'll be happy to take all of those kinds of questions. And again, please bear in mind that this year in particular is going to be an exceptional busy year. So be patient if you're asking for a personal appointment, and consider our online resources. Or we'll be doing a lot, by some I mean a lot, of kind of presentations in the community at places like local libraries or senior centers. So if you don't have a question that's too personal, please consider coming to a public presentation.
Great. Will you have any webinars or any podcasts on general topics?
Both, yeah. I am. I'm recording both podcasts and some webinars as well. And I think that again, so Alyssa has Ruby. I have Ruben the dog. Ruben was 12 last week. And so when Ruben and I were walking last night, we're hoping to see the Northern Lights. We didn't. At least I didn't. Who knows what he sees? I didn't. But I was thinking I'm going to have to just do office hours, Matt. I'm going to just schedule myself like Tuesdays and Thursdays or Mondays and Wednesdays and say, I'm going to just have a Zoom meeting from 6 to 7, and you can come
Wow.
and ask me anything you want. And I'll just sit here and drink tea. I probably should give up coffee by 6 or I won't sleep, but have a cup of tea and have a conversation with you. I think I'm getting ready to do that. Maybe you'll come and help me out sometimes.
I would be happy to.
Maybe, perhaps.
They'll
Might
hear it
like
better.
that.
They'll hear it better from you. They'll be like, that Tim, he seems nice enough, but Matt gets me.
This Matt guy just gets me. That's
Alyssa and
great.
I we are not in the business. We are not trained SHIBA volunteers, but we're interested in the topic. And there's some general topics that we do understand, and we're happy to share what we know or refer you to somebody who can give you the answer.
Well, I
Yeah.
appreciate that.
Yeah. At the very least, we'll point you in the right direction.
Thank you. Thank you. So maybe, Alyssa, I'll just do a quick review and then you tell me what I missed for today's program. So I guess we started by acknowledging that we're really today talking to folks who are in the PEBB portfolio of Medicare retirees. And that's different than our previous conversation about folks who retired and didn't have the option of joining that group and are in the commercial market. And for that specific group of HCA PEBB Medicare retirees, PEBB did move right, the open enrollment dates. So the new dates are October 28, November 25. So for people who are used to thinking it's the last day of November, the new deadline is the Monday ahead of Thanksgiving. And again, because this is a group, it's not the same as the deadline that you're going to see plastered all over the place for Medicare retirees who are not in a group. So for the general Medicare population, October 15, December 7, but for those of you who are in the HCA PEBB group, October 28, November 25. And then we talked about kind of what's changing for next year. Of course, most people are in UMP. Significant change for UMP is rates are declining, still very high. So that's going to sting, right? But some rate relief. And again, the RPEC and the coalition had a lot to do with that. So you deserve credit. And your prescription drug benefit now will be offered through a Medicare Part D plan that we refer to as an employer group waiver plan, because the HCA is part of the negotiation with the Medicare agency and the drug company to get you an enhanced formulary, a better provider network, and generally better coverage than the commercial market. But Matt and I are going to suggest that regardless of the fact that very few people are probably impacted by this, go ahead and check out your drugs that you're taking with that company MODA, which is the pharmacy benefit provider, about the details. The second big change, of course, is that for some people, and I'm looking at our friends in Southeast Washington, the Kaiser plans will no longer be available. And so for a lot of people, making a change this year is optional, but for these folks, it's going to be compulsory. You're going to have to make a change. In terms of like HCA administrative stuff, if you don't change, they're not putting you out of the group. They will put you into uniform medical plan. So just beware that there's a bit of a safety net, but you're looking at a pretty significant, like twice as much monthly premium if you don't take action to make a plan change yourself. And then finally, we talked about that for anyone in the PEBB portfolio, it's always an option to exit the group, but there's real consequences to doing that. So kind of be eyes wide open that The group rates are expensive, but it's because it's such a good plan. They're all really good plans. And as Matt reminded us, they're subsidized to the tune of about 50%. So even if a plan as good as this was available in the commercial market, which it's not, you would pay about twice as much to get it. So it really is a significant benefit that you get in appreciation for your years of service to the state of Washington or whichever political subdivision that you worked in. Alyssa, what have I missed?
Well, I just had a question on Kaiser. So for the folks who it's not going to be available in their area anymore, are they okay until January though? Are they still able to get care with Kaiser for the rest of this year? And then just what goes into effect in January? Am I right there?
Perfect. Yeah, thank you for that. Yes,
Mm.
no changes for anyone until January.
Okay. Well,
So
that's
no
something.
disruption to pharmacy, no disruption to providers. Yeah, I mean, I guess, some people are still going to feel like it's kind of a crush of time. They're going to feel pressed for time, but realistically, they have well, I guess when they hear this, right, until November 25. So it may not feel like ample time, but we hope, Matt and I, that we've highlighted some, good resources for you to help navigate this. Please know that you're not alone. The SHIBA volunteers will be happy to help you, RPEC members, the HCA, or the health plans. Good online presence and 19 benefits fairs across the state.
I
I have
think
one
that's,
thing to
oh,
add.
okay. I was about to
I
say, I think
do.
that's all. Go ahead, Matt.
Well, I am a perfect example of human behavior and procrastination. So it is very, very important for all of you to realize that November 25th means that's the last day that HCA and PEBB will accept any notice of change that you sent them. If you want to change plans, they have to have it by November 25th. So if you mail it, you better mail it way before the 25th.
Yeah, okay. It doesn't matter if it's postmarked before then, does it?
Right. It does not matter. If you want to fax it, well, yeah, you can tell yourself, I'm going to fax it. But guess what? If everybody else is faxing on their single line, it's going to be busy. There is a secure access Washington way to submit that I submitted. It was not intuitive, but I was able to use that. And there's also, you might, if you put it off long enough, you might have to drive it down there, which that would not, or up there or over there. So please do not wait until the last minute on these decisions. And let's take SHIBA volunteers for an example. If 3 days before the 25th, you call them up and say, I need to schedule an hour with the SHIBA volunteer, Tim, what are the odds of that?
I hate to say zero, but it's going to be a number very close to zero. Yeah, everything you said right there, Matt, is right. So, please don't wait. I'm appreciating we don't want to rush you to judgment, but please finish early. Get done and then enjoy Thanksgiving.
Yeah, right. Just get it out of the way. It can be it's easier to procrastinate whenever you're just everything seems so daunting and it's just I don't want to deal with it right now. Totally relatable, but yeah, as we've been talking about for all of Medicare on air, or wait, no, hang on, that's not what we're calling this series. Medicare on air. That's good too, but it's RPEC on Medicare.
And can we agree
just how important
that you're the pet project coordinator?
The pet project coordinator. Yeah, my pets really are a project and they require a lot of coordination. They're very special little girls. But yeah, if you've listened to the other 3 parts, you'll know that we've really been talking about staying on top of your deadlines and how just even if you don't necessarily have to do anything, you really, really should at least do some research to make sure everything's okay, because there still could be changes, even if you don't have to, act on those, you'll still be affected.
Yeah. And I just want to acknowledge that, Matt and I are kind of, using Thanksgiving as this significant marker, get them before Thanksgiving. But I just want to acknowledge that the day after is a state holiday celebrating Indigenous Peoples Day. So all respect to our Native and Indigenous people who are listening in.
Absolutely. Yeah.
Thanks, Tim.
Thank you. Well, geez, that's the season finale of RPEC on Medicare, and I'm real sad to be ending it, but we can still
Been a
have you
treat.
all on. Yeah, it has been. It's been a real treat, and I have learned a lot. So yeah, I just wanted to express my gratitude to both of you for taking the time to do this, and
My pleasure,
I'll
Alyssa.
definitely
My
be in
pleasure.
touch with you all. And to our listeners and our members, thank you for tuning in. And we hope that this has been really helpful for you all to help guide you as to what the next steps are. So after this series, we're back to the regular RPEC on air. Stay tuned, pay attention to our alerts, and you'll get notice of that once it's released. And be sure to check out our landing page that goes over Medicare Open Enrollment. There will be a lot of resources on there for you as well that we have compiled together. So with that, thank you all so much, and thank you for tuning in to RPEC on Air. We'll talk to you next time.
And special thanks to Tim and SHIBA. They're
Yes.
superstars.
Oh, Matt, that's very kind. Alyssa, just so grateful for you extending the opportunity. And we very much value the partnership. And thank you to Lori and Derek and the other folks that you work with.
Thank you. That's it. We've zipped it up, buttoned it up. Me. All right.
You're like that cartoon where Bugs Bunny sprays his throat with the perfume before he.
I can make sure the mic is ready for me. All right.
Hot mic.